Hello and welcome to my channel. I'm your host and tutor, Annalise Garrison. I have actually made this video before, but I need to make it again because we all need to learn how to use the clinical judgment measurement model. So today, this video is going to be about how to study for a topic when you don't know the material. All right, that's what I'm going to teach you today. And this works for the NCLEX, the HEXI, and the ATI. And for those of you that are new, we have to learn the clinical judgment measurement model. So let's do this. So what is the clinical judgment measurement model? You may or may not realize this. Yes, we know that the NCLEX is testing this, but what exactly is it? The clinical judgment measurement model has 6 steps. It takes the place of the nursing process that has 5 steps in it. So for those of you who remember your nursing process, what was it? ATI. What's ATI? Assessment, diagnosis, planning, implementation, and evaluation. I went over that so quickly because we don't need to know that anymore, guys. You should be doing the clinical judgment measurement model for your care plans as well as knowing it for your NCLEX. So if those of you who are listening to this video has never heard of the clinical judgment measurement model, you better ask your teacher about it because they should be teaching you how to use this model to do your care plans and to study for every single test you're taking in college. All right, now let's get into the purpose of my presentation here today. So when you sit down to study, guys, and you don't know the topic, write yourself a little outline. This is the outline that I want you all to follow when you're studying, whether you read a textbook or you read the case study online or wherever you read it. This is what I want you to follow. First, I want you to identify the illness or whatever you need to know about, right? Whatever topic you need to know about. I want you to write that illness or topic down and ask yourself, what is the disease? Or what am I trying to learn? What is it that I am looking at? Okay, think about that. I want you to write just 2 or 3 sentences. Just write a short paragraph about what the illness is or what the topic is that you need to learn. If you're reading a textbook, I want you to write the top 4 signs and symptoms, right? Think about the nursing process there. If you're reading a case study, I want you to pay attention to the client's chief complaint and how the client presents itself, right? I want you to get an understanding of that illness. Ask yourself, what is COPD? Or what is pneumonia? Or what is congestive heart failure? Whatever the topic is that you're trying to learn, just write 3 or 4 sentences on what it is. Just a short paragraph. Okay, step number 2 in our outline. After we get an understanding of the disease or an understanding of the topic that we're trying to learn, I want you to write 4 or 5 signs and symptoms of that disease process, right? We can't possibly know everything. Right, guys? We can't possibly know everything. So take the top 4 signs and symptoms of that disease. In the clinical judgment measurement model, this would be part of recognizing cues, right? If you are reading in a textbook, write down some signs and symptoms. If you are reading a case study, like I said, start writing down why the client was there. What exactly is wrong with them, right? Start writing the cues in their chief complaint. because we will need to refer back to these cues as we go on and learn more or answer the questions on the NCLEX or the HEXI or the ATI, right? It's all part of step 1, recognizing cues. Okay, after we have written down the highlighted signs and symptoms, right, the major signs and symptoms of that disease process, I also want you to think about some lab tests that that client might be taking to rule out pneumonia or to rule out congestive heart failure or atrial fibrillation or whatever the problem is, right? So write down some of the labs and diagnostic tests that patient might have to undergo with respect to that illness. This would be step number 2 in the clinical judgment measurement model, which is analyzing cues. For those of us that remember the nursing process, this is all part of the assessment process. Recognizing the signs and symptoms and thinking about looking at the labs and looking at the diagnostic tests. This is all part of the assessment, looking at your patient, right? Your subjective and objective data, all part of assessment. The other thing I want you to think about at this time, there is no way you guys can know every drug for every disease, and there's just no way, right? So if you're studying, let's say, if you're studying diabetes, for example, write down some of the main drugs that you take for diabetes or congestive heart failure or pneumonia or whatever it is, right? Write down the main drugs. When you write down the drugs, also write down the adverse reactions, some of the major signs and symptoms of those drugs, and what the nurse would do as an intervention should the client have a problem with those drugs, right? Should the client have an adverse reaction to those drugs. Drugs are very important, and we don't study them. We forget about them. We think that drugs are a separate entity, in and of itself. Yes, pharmacology is a separate entity, but it will be a lot easier if you address the pharmacology issues as you go along. Again, write the main stuff, write the highlighted stuff, not everything, maybe 3 or 4 drugs that pertain to that particular disease or whatever you're trying to learn, okay? Because again, pharmacology is a big issue. So, the clinical judgment measurement model, we've done recognizing cues, analyzing cues. This is all part of assessing your client. Step number 3, for those of us writing care plans, you have at this point you want to write, when you write a nursing care plan, you have to write a nursing diagnosis, right? That was for the nursing process. Well, when we do the clinical judgment measurement model, we still write a nursing diagnosis. This is our third step. But what's new and what you should be doing in your care plans and studying for any test you're taking is that you need to come up with 3 possible nursing diagnoses, right? Like one might be, respiratory, one might be pain, one might be alteration in temp. There might be three or 4 nursing diagnoses for your illnesses. Write it down. Write down as many diagnoses as you could think of. Nursing diagnoses, right? Then what you need to do is take your top diagnosis and focus on that diagnosis. All right? So let's say we have alteration in respiration, and we have alteration in temperature, and we have pain related to. Well, what would be your primary diagnosis? The decrease or increase in respirations, okay, for example. So that's what you want to make your focus on. For the clinical judgment measurement model, this is what's known as step 3, prioritizing your hypothesis. With the clinical judgment measurement model, they're calling the diagnosis your hypothesis. And the fact that you might have more than one diagnosis, they want you to prioritize it. So, when you're studying your specific illness or topic you're trying to learn, whether it's peds, maternity, med-surg, whatever it is, you want to prioritize your various nursing diagnoses. That's what it means to prioritize hypothesis. Now, when you prioritize your hypothesis, when you do these diagnoses, you're going to come up with a care plan and nursing interventions based on those diagnoses. So it's very important that you think and list all possible nursing diagnoses. Okay, moving right along, and everybody's doing such a good job, and I want to thank you guys for listening to this video today. And moving forward, we're on step 4. So, now that you have identified your topic or your illness that you want to learn, you've written some signs and symptoms, you've looked up some labs and diagnostic tests as it pertains to your studying information, we want to, we've already written a few nursing diagnoses, haven't we? So at this point, we want to think about our plan of care. What would we be doing for this client? So the way you want to think about your plan of care is you just want to write a few notes on your client as it pertains to the nursing interventions that you might want to do for your client. Don't forget, guys, you also want to think about the nursing interventions that you might do for the medications your client takes should they have an adverse reaction, okay? Because not only are you going to need it for your interventions, but you're also going to need it for discharge evaluation, right? So you take all this into account, right? We take all of this into account, and what is this called? This is called step 4 in the clinical judgment measurement model, which is to generate solutions. For some of us that are old school and we're still doing the nursing process, this would be a plan of care. But everybody switch over to new school. Step 4, generate solutions. After we've given some thought to our plan of care and we have put in that plan of care all the highlighted, right, all the main points of how we're going to, care for our client. We've written the main nursing diagnoses. We've looked at the main labs, the main signs and symptoms. You can't possibly write everything. So write 3, no more than 5 in each of these categories, right? If you're reading in a book, make sure you write those things that are bold in your book, okay? This brings us to step 5 in our clinical judgment measurement model, and that is take action. This is what's known as implementation in the nursing process if you're old school. Again, throw it away. We're not using ATI anymore. We're using take action, step 5. This is very simple, guys. You write down the important things that the nurse would do for the client to take care of their illness, right? We're not going to say, oh, bring the client a cup of water. Okay. Oh, give the client a shot. These are obvious things unless it's a special medication in that injection. Don't write the obvious. Write down things that are, must-haves that we must do to help a client. For example, a client with asthma. One of the things we know we're going to do is we have to teach them how to use an inhaler. right? We know that. So focus on that action. Actually, this action, I would write quite a bit in this area, guys, especially if you don't know the topic. So I'm not going to say only write 5 things, because it really depends on the topic you're trying to learn, what those important things are that you're going to do for your client. So, we're all smart. We all graduated college, right? So, use your critical thinking skills and write down the important things that you would do for your client, including your patient education, right? So think about that. When I tutor you, if you get a free assessment, I will give you an assignment. I'm going to say, hey, what is one thing that you have to learn that you're having trouble with? And then I will teach you how to do this outline so that, you can do it on your own. I'm going to teach you how to do this the first time I tutor you. So, you're going to be in good shape. So don't worry about a thing. So the last step that we are going to do when we study using the clinical judgment measurement model is called evaluate the outcomes. In the nursing process, it was called evaluation, right? ATI, evaluation. Now, it's the same thing with the clinical judgment measurement model, but we just call it evaluate outcomes. So this is where teaching, evaluation, and understanding come into play, guys. And don't forget your drug instructions, whatever you might need to teach the client, or don't forget the important drugs that are important in this situation, whatever you're trying to learn, whatever disease process you're trying to learn. You have to write down the important drugs for said disease process, okay? This is the last step you see with your client. If the client has a positive outcome and everything, then they're ready for discharge. If you have any problems and the client is not better and the client is not ready for discharge, then we have to go back to step 4, which was generate the plan and start over, right? Generate solutions, take action, evaluate outcomes. We have to change those steps. So when you're studying, you might want to write down, if the client has this problem, what should I do? These are just some things to think about. So in closing, guys, I know this is a very important topic for many of you. Of course it is, right? So if you need help with your care plan, if you're writing a paper, and or if you're studying for the NCLEX, whether that's the HEXI or the ATI or anything, you will need to know this concept. And I do have a special 2-hour tutoring session available just for you. So please contact me on the number that you see on your screen. And I will say thank you for joining me. God bless, and I'll see you in the next video.